Good day to all. Today we are going to discuss the blood supply of heart in detail. Blood supply of heart is also called as coronary circulation because the circulation is done by coronary arteries. So what basically is coronary circulation? In general, it is the blood given from the heart to the heart, and again the blood taken from the heart and is again given back to the heart. Like the two coronary arteries, these are the two coronary arteries which arise from the ascending aorta. So the blood is taken from the heart, and these coronary arteries are supplying the heart muscle. So it is the myocardium that it gets its supply, and the blood from the heart is again drained by cardinal veins. So the blood is again drained from the heart and is poured back into the right atrium via the coronary sinus. So, and the most important thing is, this is the ascending aorta which arises from the left ventricle. So these are the two slender red things, pipe-like things. These are the coronary arteries which are arising from the ascending aorta. So you can see here that the circulation of the coronary arteries happens during diastole. That is the characteristic feature. So we'll go and see in detail how it happens. So there are a pair of coronary arteries, the right coronary artery and the left coronary artery. And these coronary arteries are called as vasa vasorum. What is vasa vasorum? The vasa vasorum are the vessels that supply another vessel. So developmentally, the heart is formed by the fusion of two heart tubes. So the heart itself is considered as a large vessel. That is the reason the coronary arteries are known as vasa vasorums, which are the largest vasa vasorums that are present. So this right and left coronary arteries, they arise from the aortic sinuses of the ascending aorta. So this right coronary artery, it arises from the right aortic sinus, which is known as clinically, and anatomically we say that it is arising from the anterior coronary sinus or the anterior aortic sinus. So the left coronary artery, it takes its origin or it arises from left aortic sinus as it is known clinically, or we can say that it arises from left posterior aortic sinus. There is another sinus which is called as posterior aortic sinus because the ascending aorta has three cusps. So the posterior aortic sinus is called as a coronary sinus. Since we have only a pair of coronary arteries and are arising from the right and left coronary sinuses, aortic sinuses, so the posterior aortic sinus doesn't have one. So is the reason it is called as a coronary sinus. And the most characteristic feature here with these coronary arteries is they supply blood to the heart in diastole, because maximum filling of these cusps, it happens in the diastole, or normally it is in the systole that the blood is supplied to all other tissues of the body. And another important thing to be known is, as you all know, is the heart is filled with blood in the cardiac chambers. But The endothelial surface, that is the inner surface, of about 75 to 100 micrometers, that minimal thickness of the endothelium only receives nutrition from the blood that is present in the cardiac chambers. For that reason, there is necessity for the blood supply to the heart. So from inside outwards, the layers of the heart, as you all know, is the endocardium, then it is the myocardium, then it is the epicardium. So the endocardium itself, only a very, very thin part is being supplied by the blood that is present in the cardiac chambers. So all the layers of the heart does receive blood supply for its proper functioning and the nutrition. And these coronary arteries are called as end arteries. But these coronary arteries, you can see there is anastomosis that's happening between the two arteries. And all these major arteries, they run in the grooves on the external surface of the heart, like in atrioventricular groove, anterior and posterior interventricular grooves, like that. So the crux of the heart, which is the junction of interatrial groove, atrioventricular groove, and the posterior interventricular groove, it's on the posterior surface. That is the crux of the heart. So the main anastomosis of the right and the left coronary artery, that is mainly the circumflex artery, which is a branch of the left coronary artery, the anastomosis occurs nearer to the crux of the heart. Since there is anastomosis and still we are calling them as end arteries. What do you mean by end arteries? The end arteries are the arteries which do not have further anastomosis with the other vessels. But here we are finding anastomosis that is happening between the two coronary vessels. So these coronary arteries are considered as anatomical end arteries. So anatomically, they are not end arteries, but the anastomosis that is happening between the coronary vessels is impervious. That is, it is not functional. So the coronary arteries are functionally end arteries because there is no free anastomosis that occurs between the two coronary vessels. But anatomically, they are not end arteries because there is anastomosis that is happening between the coronary vessels. And this anastomosis occurs at various levels. So on the surface, that is what we are seeing, all this anastomosis which is taking place on the surface of the heart, that is the superficial anastomosis. Subepicardial, the outer layer is epicardium. So just beneath the epicardium, there is anastomosis that is happening. Below epicardium is the myocardium, which is the muscle of the heart. So the myocardial anastomosis is seen, and interior to the myocardium is the endocardium. And there is subendocardial anastomosis also is seen, as we have said earlier, that only a very minute thickness of the endocardium gets its nutrition from the blood that is collected within the four chambers of the heart. And the most important thing to be remembered is the coronary arteries are the only vessels which supply blood in diastole. Now coming to the coronary arteries proper. So as we said, there are a pair of coronary arteries which are arising from the ascending aorta through the aortic sinuses, the right and left, and they run and the grooves that are present on the external surface of the heart. So let us see them in detail. So now coming to the right coronary artery. This is the right coronary artery. So it arises from the anterior aortic sinus, or the right aortic sinus as clinically it is also called as. And at first it descends forwards and to the right between the pulmonary trunk and the right auricle along the right half of the atrioventricular groove. So this is the atrioventricular groove. This is the right atrium and the left atrium, the right ventricle and the left ventricle. So this right coronary artery, it descends down and to the right in the right part of the atrioventricular groove on the sternocostal surface. As it approaches the inferior border, it winds round the inferior border of the heart and passes upwards and towards the left along the posterior part of the atrioventricular groove till it reaches the crux of the heart, which is the meeting place of the interatrial septum, atrioventricular septum and the interventricular septum on the posterior aspect of the heart. And anastomosis with the circumflex artery, which is the branch of the left coronary artery, little left to the crux of the heart. So in 60% of cases, it anastomoses with the circumflex to the slightly towards the left of the crux, and in few cases it may reach the inferior border and anastomose with the circumflex, or in a very rare cases it may anastomose with the circumflex between the atrioventricular groove and the inferior border of the heart, somewhere here. So this right coronary artery is divided into two segments. The first segment is the part that is present on the sternocostal surface, and the second segment of the right coronary artery is the part which is present on the posterior atrioventricular groove, which is anastomosing with the circumflex branch of the left coronary artery. So we are going to see the branches of right coronary artery in the first segment and then in the second segment. So there are about 5 branches in the first segment and 5 branches in the second segment. So there are about 10 branches that are concerned with the right coronary artery. And those branches are, we are talking about the first segment now. So the first segment is from the origin of the right coronary artery, from the anterior aortic sinus or the right aortic sinus till the inferior border of the heart. So this is the first segment. So the branches of the first segment are the ventricular rami, the right conus artery, the atrial rami, right marginal artery and nodal artery. So to make it a little simple, if necessary, you may remember by the mnemonic CM1. C stands for the conus artery, M stands for the marginal artery, V for ventricular rami, A for atrial rami, N for the nodal artery. So let us see these arteries in detail. So there is ventricular rami. The ventricular rami are of 3 to 4 in number, and they arise at the right angles to the main trunk, that is the right coronary artery, and supply the sternocostal surface of the right ventricle, of which the first ventricular rami is considered as the right conus artery, and the last ventricular rami, which is the largest and the longest ventricular rami, is also called as right marginal artery, as it is along the margin of the inferior border of the heart. So this is also called as acute marginal artery, because this right marginal artery, it takes an acute angle from the right coronary artery, that is less than 90 degrees. And this right marginal artery, it passes till about the apex and supplying the adjacent surfaces of the heart, that is the sternocostal surface and the diaphragmatic surface nearer to the inferior border of the heart. So the next branches are these atrial rami. These atrial rami are also about 4 to 5 in number, and they are grouped into anterior branches, lateral and posterior branches. These anterior and lateral branches are right angles to the right coronary artery, and they supply the myocardium of the right atrium. This is all is right atrium. That is the reason it is atrioventricular, anterior atrioventricular groove, isn't it? So these atrial rami, they supply the myocardium of the right atrium. So the largest atrial rami, which is almost the first artery on the atrial side, atrial rami, is called as sinoatrial nodal artery, in other words the nodal artery. So this nodal artery, as it arises, it passes upwards and backwards between the right auricle and the ascending aorta, and then it arches over the superior vena cava and then passes through the substance of the sinoatrial node. That is the reason this nodal artery has its name as sinoatrial nodal artery, and supplies the sinus node, that is sinoatrial node. So if there is any occlusion to this sinoatrial nodal artery, there is no proper functioning of the SA node that happens, which may lead to sinus arrhythmias. And one of the ventricular rami, the superior one, is called as right conus artery, which can also arise before the nodal artery. So it also is regarded as the first branch of the right coronary artery. At times what happens is, this right coronary artery may arise directly from the anterior aortic sinus along with the right coronary artery. Then this right conus artery is known as third coronary artery. And this right coronary artery, it anastomoses with the left conus artery, which is arising from the anterior interventricular branch of the left coronary artery. So there is an anastomosis that happens between the right and left conus arteries, which supply the infundibulum of the pulmonary trunk. They form a necklace sort of an anastomosis on the infundibulum of the pulmonary trunk. So this condition is called as annulus of Vuissens. So it is a infundibular anastomosis. That is called as annulus of Vuissens is nothing but the anastomosis that is between the right conus artery, which is a branch of the right coronary artery, and the left conus artery, which is a branch of the left coronary artery, in front of the pulmonary trunk, that is at the infundibulum of the pulmonary trunk. And now coming to the branches of the posterior segment, that is the second segment, which is in the posterior part of the atrioventricular groove. And the branches again here are the ventral rami, the atrial rami, the posterior interventricular branch, which is very important, septal rami, and nodal branch. These branches you can remember by a mnemonic PS1. So the first segment is CM1 and the second segment you can remember as PS1, personal secretary for the CM. Either way, you can just remember the branches is fine, or for your flexibility, I'm just saying this. It is by PS1 you can remember. So P stands for posterior interventricular branch, S stands for the septal rami, V stands for the ventricular rami, A stands for the atrial rami, N stands for the nodal branch. Now let us see them in detail. So this segment we are talking now, this part, after the right coronary artery has wound round the inferior border of the heart and is present in the posterior part of the atrioventricular groove. So now the branches, what we are going to see are the ventricular rami. So these ventricular rami, they supply the diaphragmatic surface of the right atrium. This is the right atrium, right? So they supply the diaphragmatic surface of the right atrium. So this is the posterior aspect figure. This is the right coronary artery, which is anastomosing with the circumflex branch, little left to the crux of the heart. So these are the ventricular branches, the ventricular rami, which is supplying the diaphragmatic surface of the right ventricle. So coming to the branches of the second segment, that is the posterior interventricular branch, another branch of the second segment. So this posterior interventricular branch is getting its name so because it is present in the posterior interventricular groove on the diaphragmatic surface, and it also supplies the posterior part of the interventricular septum as well. That is the reason this branch has its name coined as posterior interventricular branch. So this posterior interventricular branch arises from the right coronary artery nearer to the crux. So this is the crux, which is the meeting place of interatrial, the atrioventricular, and the interventricular septa on the posterior aspect. So this is the crux. So this posterior interventricular artery, it arises from the right coronary artery nearer to the crux. The importance of this artery is based on the origin of this posterior interventricular artery. The coronary dominance of the heart is rated. So if, like normally, the posterior interventricular artery, if it is arising from the right coronary artery, then that heart is considered to be right coronary dominant. So we say that there is right coronary dominance for that heart. If suppose this posterior interventricular artery arises as a continuation of the circumflex branch of the left coronary artery, then that heart is considered to be having the left coronary dominance. In very few people, very few percentage of the population, the posterior interventricular artery may arise from both the right and the circumflex branch of the left coronary artery. Then that heart is considered to be of a balanced type, having codominance. So this interventricular artery, the posterior interventricular artery, it supplies the posterior part, that is the diaphragmatic surface of both right and the left ventricles. And it also gives a branch which passes through the substance of the interventricular septum, known as septal branch, which supplies the posterior 1/3 of the interventricular septum as well.